Hi, Dr. Ameen. How are you?
I'm very well. How are you, sir? You look amazing.
Not as good as you.
Oh, well.
How is everything?
Oh, it's very well, very well. Well, I'm based in Kuala Lumpur, and with all the corona and the COVID-19 exposure, they have a better control of it. So it's much better over here.
Yeah.
People are resuming back to work, and slowly the normalcy is returning at much slower pace, I would say.
Okay. Well,
How is life there? What's happening?
here is a little bit of a mess. I'm sure
Indeed.
I'm sure you've heard about it. There's riots just a
Yes.
few blocks from my house.
Oh dear. Okay. Wow.
I can hear them from here.
Hmm.
Yeah. So it's a bad. It's a sad moment for the country,
Indeed.
but
Indeed.
it's
Indeed.
but it but it it's something I believe needed to happen because there's never change.
Right. 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 What happened was I was just talking to my spiritual master, and he says the whole world will take a healing, whether it is emotional, or it is attitude based, or it is like the whole species based evolution that's happening. So I think this is also happening at the right time because this healing has to happen. This
Yes, no, for
negativity.
sure. Yeah, this situation with the way with racism and
Yeah.
how dangerous it is to be a person of color in this country is
Right.
not okay,
Yeah.
and something has to happen.
True.
And
True.
it's enough of saying thoughts and prayers for the victims, and that's it.
True. True. It doesn't go beyond that point.
Yeah, and I'm excited to talk to you today because heard you
Let's say,
I heard you speak the other day, and I was fascinated by your point of view and your opinions, with
thank
with
you.
with which
Thank you.
I resonate completely. But there's a couple of things that I'm curious,
Please.
and I wanted to ask you about your point of view and what basically what you do, right?
All right. Sure.
One of them is, what is the Ayurvedic view and your own take on psoriasis, eczema, and these supposedly autoimmune conditions? What do you do? How do you treat these people? What kind of results do you see?
Fantastic. Uh, First of all, sir, to us, like personally, what I believe is this. When it comes to immune system, it's all autoimmune disorders. When it comes to immune system, you're constantly irritating, you're constantly troubling our immune system that the immune system basically start to attack our own tissues, our own bodily tissues, whether you call it celiac disease or you call it rheumatoid arthritis, you call it MS, you call it psoriasis. It just the disease process is exactly the same. It's just like the autoimmune disease. If it happens in a joint, we call it rheumatoid arthritis. If it happens in the skin, we call it psoriasis. If it happens in the gut, we call it leaky gut or inflammatory bowel disorder, irritable bowel syndrome. In your brain, we have so many different names. Even to me, I personally feel even Parkinson's, Alzheimer's, it's all kind of process. And primarily, in most cases where, I mean, at this point in time, I feel that there's a huge increase in autoimmune disorders purely because we are just pushing our immune system to the max. Okay, as far as Ayurvedic concept is concerned, these science I'm talking about are like 5,000 years old. Then they have actually explained in such a way that when it comes to autoimmune disorders, number one, exposure. Exposure, when you challenge your immune system with, in olden days, they just called it toxins. We call it AMA, just toxins. Whereas now we have different terms. We are talking about allergenic proteins. We are talking about chemical exposure. We are talking about genetic modification, pollution. So in all these cases, the primary focus of treatment, it's more like a triangle, correct? The one side of it, primarily what we try to do is eliminate whatever possibly that can irritate your immune system and trigger this particular autoimmune reaction. So eliminate that. So cleaning up the diet. So removal means just removing things which can irritate your immune system and including things that can support your immune system. That's primary focus of when it comes to either it is psoriasis or, for that matter, I basically bundle all the autoimmune disorders with same protocol.
So what are the things that you tell your patients to eliminate?
Okay, basically it is from case to case basis. For example, if somebody comes to me and they have problem in their skin and they are smoking, so it becomes smoking. If they are into alcohol, it becomes alcohol. If it comes to diet, if they are Agni, so that's why it's a triangle. Okay, so the first part is elimination, where when we do the case study filing, that will basically show what may possibly be the reason and what need to be eliminated. That's number one. Number two comes to Agni. Agni means how much of prana, the life force, the fire they have. In modern terms, in functional medicine side, we may probably think of it like the digestive ability. We are talking about leaky gut. That's second side of it. We think it's a new exploration. This has been like 5,000 years old science. We all know about it. You get a disease.
So is it lack of Agni, decreased Agni, or increased Agni?
Both also can happen, but primarily the Agni never increases in older people. It's always low. Tell me which organ functions better as you age? Nothing, right? So pretty much it boils down to that. So the Agni has to be supported. You don't want too much of it. You don't want too little of it. And you don't want one type of Agni moving into another zone, like Prana, Apana, Udana, Samana. These are all the Agnis, the fire in different body parts. Like there is fire in your eyes, there is fire in your brain, there is fire in your lungs, there is fire in your stomach. The fire in your stomach, when it escapes, the stomach fire reduces, but the fire goes into lungs, you get a lot of inflammatory cough. It goes into your brain, you get a lot of headaches. So things like that. You want the energy in specific areas and maintain a proper homeostasis. Ayurveda or natural medicine, for that matter, is always about homeostasis. So that need to be restored. The third side of it, when you are born, we call it dhatus. Dhatus means it's basically, when you're talking about doshas, like you have muscles, bone, tissues. We call it rasa, rakta, mamsa, medas, asti, majja, sukra. Okay, these are all what you're born with. When you're born with, it can be called as genetic weakness. You are like a chain. When you put enough of pressure, the chain, whichever link is weak, that's when it snaps. So when you go through autoimmune disorder, your immune system will only attack the zone that is weak in your body. Now, if your father is a smoker, you are born with weak lungs. When you get autoimmune disorder, when you push your body, the symptoms is primarily connected to lungs. When your father never take care of, or parents never take care of their skin, they're exposed to a lot of abuse, then most of the toxins in their skin. So when, as a kid, we carry all this information in our genetics. When I push my immune system to the maximum, the weakest link in the chain is my skin. So I develop psoriasis. If it is brain, you develop MS. If it is in joints, you develop arthritis. If it is any dhatu, for that matter, right? So that becomes a problem. So when you're talking about, say, psoriasis, primarily right now, most of the people are primarily concentrating on relieving symptoms, curing the disease, whereas behind the screen, there's a lot of things going on. So what I do in my protocol is that, okay, first, there are three things we need to do. One side, we actually remove all the dirt, whichever that can challenge the immune system. We just remove that. Either it is dietary, or it is lifestyle related, or it is medicinal related. Sometimes it is emotional related, or, sleep, stress, every aspect of life. I don't think any one thing is important than the other thing. It all has to be happen simultaneously.
Is there something that you tell all your patients to remove?
Everyone. They all go through a complete removal process where there is no animal protein.
But what I'm asking is there something in common that you tell all of them?
Pretty much everyone. There's no animal protein at all. Animal protein, I mean, there's no milk. There's no milk related, no eggs, no cheese, no mutton, beef, pork, none of that. Just completely clean up. And why? I try not to give them. Okay, purely because to me, when their Agni is not there, they can't exactly digest these proteins that well. When the proteins are not digested, you see, proteins are supposed to digest and become an amino acid. These amino acids are the building blocks for your body. But when you understand, when you don't digest very well, the peptides are chains of amino acids, which is leaking into the bloodstream. And your body is going to look into the peptides, and they may probably mimic like your skin and your immune system produces antibodies to attack these peptides, and these antibodies also going to attack your bodily tissues where it's just ongoing. If we don't remove these causative factors, you see, even removing this, it's going to take 14 days before the antibodies come to a neutralized state. So there's a repetitive exposure despite the best of treatments.
So all animal proteins are out.
Absolutely.
What else?
I'm not talking about forever. I'm talking about, I do a 48-day protocol during that particular time.
Until you heal.
Perfect. You just said it right. Okay. Once that's done, the second part, of course, manage the stress, get enough of sleep. And I do use a lot of different herbs. We call them immunomodulatory herbs, which means they modulate your immune system. Sometimes the immune system is very aggressive. And we are always talking about boosting immunity. I think that is such a wrong concept. Even when it comes to herbs, like certain herbs modulates immune system. We always seeking the homeostasis, which is the perfect balance. So that's phase 2. So select certain kind of herbs and
because sometimes if the confusion of the immune system is not removed and you boost it, you worsen the autoimmunity.
Precisely. For example, we have the herb called neem. Neem is a fantastic immune booster, but it just boosts us to the level that if somebody have like an organ transplant, like kidney transplant, if they take the neem, the body will reject the kidneys. And not many people know that. They just keep giving it. Whereas when it comes to either amalaki or turmeric, they are immunomodulators. So we need to know in which cases they need to be boosted, in which cases they need to be modulated. So that is phase 2. So this antibodies need to be neutralized. So we need to remove these foundational proteins and everything out of the diet. So that's basically taken care of. Second, and we eventually start to gradually build up the Agni, which is the stomach fire, the digestive enzymes. We are talking about hydrochloric acid. So once it builds to a certain level, now when you reintroduce things, the patients can actually digest them. So I don't think anybody can be allergic for the rest of their life, for that matter. Whether you're talking about gluten, you're talking about any other form of allergenic proteins, the minute they have the fire, the allergy just never happens because proteins are digested into amino acids. Amino acids are basically building blocks of your body. Your body can easily utilize that. So that's the secondary side of it. Now, so building the acid in the stomach is phase 2. So thus, we are talking about all the different enzymes. I put them primarily on a soft diet, nothing too complex. We remove anything that is raw. So there is no salads, there's no undercooked food. Why? It basically puts off the Agni. So you have to build the fire, which means primarily the food is a bit cooked, but we use a lot of ginger, garlic, very acidic. Like I also use like some apple cider vinegar. I use a lot of like digestive enzymes, lipase, protein, amylase, all the combinations.
So cooked vegetables.
Cooked vegetables, yes. And use all the spices, but milder form of spices, not exactly chilies, which can disrupt the gut, but not nightshades. I try to remove all the nightshades because they are pro-inflammatory. So when we put this...
What about lectins?
Okay. Actually, I personally believe that there's a lot of wrong concept about lectins. It's a topic that's been unresolved yet. And to me, lectins, we have grown up as a species. We are exposed to lectins for this long. So I'm not that against it per se, but in cases where there is acute inflammation in their gut, they are purging, there is a lot of irritations. In those cases, I encourage them to keep the lectins a bit low, but I'm not against. I feel that lectins are anti-cancerous. If your health is perfect, going against lectin is something like, to me, lectin is actually a phytochemical. It's been put in there for a particular reason. When we actually eat it, it can do a lot of good. It's basically a prebiotic. Our gut bacteria love it in a way. So that's a give and take. That's why in ancient Indian wisdom, we always soak all the nuts and seeds, all the pulses, everything overnight in water to reduce it. And we encourage it to be pressure cooked. When you pressure cook it, most of the lectins are basically dissolved or digested or made less, it has less impact. And we use a lot of garlic and ginger in the process of cooking, which actually keeps the lectin levels low. But again, it was never a primary concern.
What about nuts and seeds? For psoriasis, I'm talking about.
Okay. When it comes to nuts and seeds, number one, it has to be raw nuts and seeds, and it has to be only introduced in phase 3 in the process of reintroduction. So not in the first 2 weeks. It's just removal. Removal means they're basically something like a very gentle, soft diet with a lot of vegetable and everything. Again, the severity of psoriasis very much depends, but as long as we just focus on cleansing, purifying the body, once we're done with that. Now, also we're talking about genetic weakness, which are the, like in psoriasis case, we're talking about the skin being very weak. There are things we need to do to support the health of the skin itself. Either, so we have like three different aspects to it. One, build the fire, which is the Agni. Other side, clean up the body. On the third side, build the strength of the Dhatu, which is the particular organ or system which is weak. So we need to take care of all these three aspects simultaneously. So it becomes like a balance. But as we are communicating to the patient, when we are extracting the data, it will give, are you supposed to do like 30, 30, 40? Or are you supposed to focus 80% on cleansing, 10% on building the Agni, and 10% on strengthening the weakness? So this is an art. That's why we always call it medical practice, isn't it? We are practicing, and we can never be very accurate about it. So I personally don't believe in standardizing things. It has to be a patient-centric rather than a program-centric. So when we go this way, every one of them start to get better. Complete transformational. Like I had a patient in her early 30s. She had pustular psoriasis, and she was about 82 kilos. Pustular psoriasis. It's all over. The hair being lost and everything. It took about 3 months plus, but she has come down to 64 kilos right now, and she has completely lost the weight. She started to grow new hair, and all the pustules completely disappeared. And she was basically put on methotrexate. Beyond the steroids, they just couldn't able to control the immune system, where it just completely out. And she's just taking some basic, simple herbs and living happily. I mean, this is just one of those rare cases, but the transformation is unbelievable. So that's the kind of case.
And of course, we're talking in general now, because I do have a question specific about certain specific, but in general, what are the herbs that are good for psoriasis, and what are the herbs that one should avoid for psoriasis?
Okay.
And we know that neem is one to avoid.
Yeah. So again, this is where the challenge becomes, because in Ayurveda it is never a standardized prescription. So that's why we have doshas. We have Vata, Pitta, Kapha. My understanding of dosha is slightly different. Okay. So when you're talking about the whole body, when it comes to Kapha, we are talking about bodily structures. I mean, I'm talking about muscles and bones and organs and tissues, just what it is made up of. We are talking about just a ka. Like, you don't put any fluid, nothing. When you just look at the ka, that is Kapha. All right. So it's bodily structures. Okay. The second thing becomes Pitta. Okay. Pitta is basically like all the fluids and fuel and enzymes what we put into the ka. So like in our body, it becomes all the hormones and all the enzyme activities, because that's what basically keeps the physical structure rolling. So that becomes Pitta. The third part of it, which is Vata, when you think about Vata, that becomes the nerves, the electric communication, the process of thinking itself. So if we relate it to the car, that becomes the driver who drives the car. So Vata will be the driver who drives the car, because that's what the primary purpose is. The Pitta is the fuel, the engine oil, the coolant, and all those fluids to make the parts run smooth, all the lubricants. And Kapha becomes the physical structure, the car itself. It all has to three work together, in a combination for a better outcome. When it comes to our body, also the same. So when you're talking about, say, psoriasis, when you're looking at a particular person, and you're going to think from all different perspectives, is the Vata, is the Pitta, is the Kapha, is everything in balance, is there dryness, is there excessive fire, is there less fire? So it becomes, again, it's more of an art of putting all the herbs together and finding the person, because the same prescription can produce completely two different results in the same presenting symptoms. So this is where, on the other hand, there are herbs which are basically in nature, supports your overall body. Okay, this we call it ojas. Okay, ojas sits above Vata, Pitta, Kapha. It is your body. For example, amalaki is one of such herbs. Whether you have health issues or whatnot, so nevertheless, we can still take amalaki, and that basically improves the overall collagen in the skin, the health of the overall skin. So what happens is
Amalaki is like the puppeteer.
Precisely, so that basically start to arrange where your body will have very high level of vitamin C, improving collagen, the health of the skin itself, whether it is pitta, less kapha, the body still start to become rejuvenated. So what I try to do is I try to focus on this. Okay, we need to cleanse, purify the body. Triphala is one of the best things, and it is applicable to all conditions. So particularly when it can safely take Triphala. Why? We still have to clean up the body. That's one side. Second, we are talking about building the fire, digestive enzymes. So we have like Trikatu, the pepper, the ginger, and all those kind of things. It actually increases fire. In which case, fire? Every case. There's no exception. All right. Then the third side of it, we are looking to build the genetic weakness. So if a patient gets psoriasis, then actually that they have genetic weakness in their skin, right? So now we're just going into the herbs and looking at, for example, in Organic India, we have this beautiful skin, there's a formulation. Then we have Amalaki, all the specific formulations that helps to nourish the skin. So when we pick up this way, we can never be wrong, and we can be very safe without challenging their person's body's immune system. The immune system will thank over a long term that these kind of recommendations. So these are the 3 recommendations I recommend in cases of.
So let me ask you, because now I'm going to ask about specific cases.
Right.
I have a patient. He's also a friend.
Right.
Who has psoriasis in both elbows and in both knees, but he also has asthma. He also has hyperreactive airways. And curiously, he only gets attacks when he goes surfing. The waters here in California are not the cleanest, right?
Right.
So in your mind, what does skin weakness and lung weakness, is there a connection? Because in the body, it's difficult to have 2 completely different diseases. When I see a person that comes to me and says, I have asthma and I have psoriasis, the first thing I try to find is what is the common link between them, right? What in your mind, asthma and psoriasis, what does it make you think of?
All right, okay. For example, in Chinese medicine, we have different meridians, we have different systems, different organs and everything. So the lung is primarily connected to the skin, according to Chinese medicine. How? The skin basically shows the sign of irritation and limitation when, particularly most of the psoriatic patients, when they are young, they always have some or other form of breathing difficulties, or they have a very strong family history of asthma. It has always been the connection. Okay, when you go into the details, why? Okay, when you think about it, in psoriasis cases, what's happening is the digestive fire is very low, which means the body is very cold. And there's a lot of systemic inflammation. When this inflammation sets off, 2 things happen. 1, your body has a priority system. What is priority system? Most of the blood flows to protect the vital organs internally, primarily the digestive engines, whether it's your liver, it's your pancreas, your kidneys, all the vital organs. And your skin is a lost on priority. So sometimes people just feel dry skin. People go through all this kind of irritation, their nails are breaking, they are losing their hair, and they think it's just perfectly fine. No, it's a sign that internally there is something very serious going on. When the inflammation sets off, people usually have a very high level of mucus secretion because their mucous membrane is primarily what goes through. Like to me, there's no difference between your internal skin and your external skin.
That's exactly what happens to this patient. He starts spitting out, coughing out, and even pooping mucus.
Right. So, it's just the inflammation what we need to reduce. So particularly when it comes to this particular patient, it's just that it confirms that the mucous membrane irritation, because to me, mucous membrane is just one, whether it is in your eye, it's in your ear, it's in your nose, it's in your gut, it's in your private parts, it does not matter. The mucous membrane all over your body responds exactly the same way. I learned from your book that it's about 70 to 80% of immune system lives in the gut. And you said the gall, which is, gut associated lymphatic tissue. And it was like mind blowing, which is the truth, and most people don't understand that. Why? Food is the only way we put in a lot of infection and inflammation into the body. Thank you, Master. And so this is how actually it works. So when the mucous membrane responds by secreting mucus, it's going to secrete mucus deep into your lungs, in your nose, in your eyes. So people start to suffer the excessive mucus secretion when there is not enough of fire. So they're just exposing themselves to lots and lots of inflammatory factors, right? So the minute we start to lower the inflammation, so it's not like a treatment where we just take some cream, apply on the skin, it's going to be fine. It's not something like you take some antihistamine and suppress your lungs, you're going to be fine. So that's like, we call it duct tape treatment, where, your car engine giving some acute sharp noise, you just cover it up with a duct tape, you don't hear the noise, your problem is resolved. It does not work like that, unfortunately. So here comes the actual solution. So start working on the food, reduce your exposure to acute toxicity. And this particular person may need something of a very, very intense form of detoxification, a cleansing process where no exposure to toxicity. On the other hand, also eliminate all this unwanted stuff where the immune system starts to stabilize, the inflammation kind of goes low, and the skin will start to get better when the lungs start to get better. So the healing is simultaneous. And in this particular person, he may be the genetic weakness we were talking about. He may be weak on 3 zones. 1, the primary digestive system. 2nd, the lungs. 3rd, the skin. So when it comes to the selection of herbs, we may need to focus on all these 3 areas. So there goes the extra holy basil, the extra pushkamul, all those particular herbs which support the lungs as well as part of the whole treatment protocol.
So what should I give him? Amalaki, Trikatu, Triphala, Tulsi?
And he also needs the beautiful skin. But to me, personally, what I feel is that we shouldn't be going anything more than 3 prescription of herbs at a time. Anything more than that, there is conflict, there is, competitiveness, and the person
So which ones would be your 3 choices?
That's right. So you see, the first phase, so that's why I try to phase patients in such a way that when we are focusing on removing, we're talking about just clean the body. So we are just focusing on not strengthening. The genetic weakness takes the 2nd stage. So first, we are going to look, is the lung problem the big issue or the skin problem the big issue? Which one makes the patient more comfortable? What is it that makes the patient more comfortable?
The lung is the most worried.
So in this case, since we are selecting 3 herbs, 1, Triphala becomes the primary herb that basically helps to cleanse the body. All right. And Trikatu is the 2nd herb that helps to strengthen the digestive fire. The 3rd one will be something like a breathe free or holy basil. So either one of the choices where the lungs are going to feel a bit more breathing. So when they feel the symptoms are improving, the commitment from the patient's side to continue the protocol all tremendously increases.
And how much of each herb?
Oh, at any level where the chronicity of the disease will dictate. In natural medicine, what we think is 1 year of suffering will be reversed by 1 week. If a patient has something for 10 years, it's going to take 10 weeks for it to be completely resolved. So in that case, so the removal of it, the dose has to be increased. For example, usually what I give in my practice is 2 capsules 3 times a day. So that's minimum standard. So every one of my patients usually take about 2 capsules after breakfast, after lunch, and after dinner of 3 different prescriptions standard.
Is more better or 2 is
Okay. 2 capsules 3 times a day is already peak. It's already maxed. One of the reason is when it comes to organic herbs, usually they are 10 times more potent than what the normal herbs we find in the market, because the concentrated phytochemicals are very active, and somehow the way they naturally dehydrated, the active ingredients are still very potent there. So I try not to go beyond that point.
And the prana is still potent in it, right?
Exactly. So that's primarily the reason why we try to stick to that. Commonly, we recommend about 2 capsules twice a day, where there's no medical person involved in it, and they're just randomly picking up off the shelf and try by themselves. 2 capsules twice a day wouldn't create a healing crisis. Whereas when it comes to 2 capsules 3 times a day, there will be healing crisis. So a medical person's present in the prescription becomes very important. So that's my suggestion.
And have you studied, or do you look for heavy metals on your patients with autoimmunity, especially psoriasis?
Okay. one of the problem what I have in Malaysia is a lack of studies, a lack of blood samples and reporting and all those. And secondly, it's an economical status because these tests are very expensive. So usually I look for obvious signs, like the skin marks. I ask them to open the mouth to look for amalgam fillings. I talk about their history. I talk about how much fish they eat, like what kind of work, if they work in a dye factory or something of that sort. So I try to extract the full history to understand if there is any exposure to metals. If there isn't, I will still think of it that they have. So I usually try to include some form of natural chelata. I try not to focus too much into like, we cannot really inject something like EDTA, all those kind of things. So instead, I try to give them a lot of like, apple cider vinegar, it has malic acid, fantastic chelata we are talking about. I give them a lot of, encourage them to take a lot of chlorella. I encourage them to take a lot of, cilantro, coriander, juices, and a lot of moringa, turmeric. These are all the things I try to give them regularly, but that doesn't become a primary focus unless they have some amalgam and they have trigeminal neuralgia. I had cases where I just insist on getting it removed by a holistic dentist. Once they remove it, within about 2-3 weeks time, the trigeminal neuralgia, what they suffered for years, just disappear like that. It's just mind-blowing. It's just that we just have a complete overall idea. We cannot take it for granted thinking like, oh, the body is very pure. There's no metals. Absolutely, there is so much of metals loaded. It's just that their body, can it cope or not, really matters. So there's always a little aspect I include in that, yes.
And do you consider that many of the chronic diseases of today are caused by viruses, bacteria, parasites? There's more and more suspicion and sometimes evidence that cancers can start, as a viral infection, herpes zoster, and all these
EBVs.
Yeah. Do you think that is accurate?
Okay. I will put it this way, sir. As a species, I think our immunity has been going lower and lower and lower. And primarily that comes because our interaction with animals, interaction with different species. Think of it like this. 10,000 years back, we are in a jungle. And how much are we to work with all the different animals and pets, and how much animals we have in our plate to eat? Very little. And our interaction with other species is much lesser, because like horses are with horses, ducks are with ducks, chickens are with chickens, and we are with human species. I think primarily when we started interacting with different animals, all these viruses, it's literally so many of the different infections came from literally by, by us dealing with animals directly. Domestication of animals, is primarily the reason for all this.
Yeah.
Now
we talk about Lyme disease and so many diseases, right?
So many diseases. Okay, now because of that, that is on one side of it. One side, we are just exposed to too many different viruses. On the other side, our own body's immune system, we are constantly challenging our immune system. And we are talking about different exposure. All this exposure are challenging to the immune system, where our immune system is dropping. Our immune system cannot cope. It can be lifestyle related. It can be a lot of karma related. I also believe in that. It can be so many different reasons where our immune system is dropping. Primarily nutrition. We are talking about phytochemicals. There is very little vegetables nowadays in people. Even the vegetarians are primarily carbotarians. They don't exactly eat vegetables. When they don't eat the vegetable, you yourself said GALT, which is gut-associated lymphatic tissue, which determines how much to augment the immune system or lower the immune system. I personally feel that it's the amount of vegetable in our diet that will determine how well the immune system is functional. Correct. Now, when the immune system is not functioning because we don't give enough of nutrition to our body for it to produce enough of potent, immune cells, that eventually leads to exposure to the viruses on one side, whereas the poor immune system is on the other side. So naturally, if somebody have poor immune system, the virus can get into their body and it can actually go through the process of, evolving. It become more virulent. And
do you do anything in your treatment to address that issue?
100%. I believe that we all have viruses which are latent, which are stuck inside our body. All right. So you can be in a perfect place where you can just go through a complete acute stress And when you go through this particular stress, we don't have to go and pick up some virus from somewhere. The viruses are inside our body. It's just that the immune system put it right under the carpet. The minute the immune system goes off, under the carpet, it just shows the hey. So most of the viral infections are like that.
And herpes and all these viruses live in the nerves, and then when your immune system goes down, they cause it.
So in that case, we don't have to go far. We don't have to look elsewhere. It's all there. But I don't think every disease is caused by that. I don't think so. It's just immune system associated. As long as the immune system is there to protect. For example, immune system is not there. If the immune system is strong enough, even most of the carcinogens cannot induce the cancer. Because the minute the normal cells become cancerous, your immune cells, we are talking about natural killer cells, can completely pick up and destroy it. It says no problem. We all average produce about 10,000 cancer cells every day. On the other hand, when the immune system is not there, there comes a problem where now it can find a ground to seed itself and grow and tumor. Somehow we believe that magically cancer appears somewhere. And the minute you just burn it, cut it, poison it, it just disappears like that. No, it's much more than that. It's very holistic. So attend to the immune system, both physically, mentally, emotionally, socially. We need all this support. The immune system, once it feels safe, that it can do its job, and we don't have to worry about any of the viruses and bacteria, not at all.
Doctor, I mean, I just love how you explain things. If I get sick, I'm going to see you as a patient. Really, I mean...
that's an honor. I mean, you have no idea, sir. I admire your words. I admire your writing.
I can listen to you for hours. And maybe, if I'm lucky, we can schedule another talk to talk about another health issue.
Pleasure. Let's do that. Of course, I think we should do that. And I have so much more to learn either way.
Thank you so much.
Pleasure.
For spending time with me. And I really hope to talk to you soon.
Please, let's do that.
I'd like to meet you in person.
Sure, let's do that. Sure. Okay, doctor. Take care. Thank you.
All my love.
Love to you too.
Bye. Thank you.